Now, it's my great pleasure to introduce the two co-chairs of this workshop. They have done an enormous job, as you heard, in a very short time. And first is Diane Griffin, who's here joining us from Hopkins. Despite the weather and the roads, she's here. And she's a University Distinguished Service Professor and Alfred Jill Summer Chair of the Department of Molecular Microbiology and Immunology at Hopkins. Importantly, she's not only a recognized leader on the pathogenesis of viral infections, known her work on measles and alpha virus encephalitis, but I can tell you she's a great leader and contributor to Academies. She's on the council, on my council of National Academy of Medicine. She's also vice chair of National Academy of Science, and she has been the president of American Society of Virology and so many others. So Diane, thank you for being here. And of course, it's also my great pleasure to introduce Mary Wilson, the other co-chair of the workshop. She's adjunct professor of global health and population at the Harvard School of Public Health. Previously, she was the chief of infectious disease at Mount Auburn Hospital at Harvard Hospital for more than 20 years, served on the advisory committee on many committees, but also on CDC and also to the National Institute of Public Health in Mexico, and of course the IOM. And we're so glad that she's here with us, and her interest clearly is the ecology of infections emerging of microbial threats. So if I can ask Mary Wilson to come up and open the meeting. Thank you, Mary.
Thank you, Victor. We are so pleased that you were able to be with us today in person despite a harrowing travel experience. Good morning and welcome. As co-chair of the planning committee for this workshop, I'd like to welcome you to this workshop on research priorities to inform public health and medical practice for domestic Zika virus. It is being hosted by the National Academies of Sciences, Engineering, and Medicine. In accordance with the National Academy's procedures, an independent planning committee organized the meeting. And this just shows the members of the planning committee, whom we thank sincerely, who have all spent many hours in recent weeks working to put this meeting together. The purpose of this workshop today is to bring together experts and stakeholders and discuss important research questions that would be most beneficial to pursue now to provide public health officials, healthcare providers, and the general public with the most up-to-date information about Zika virus transmission, health risks, and measures that should be taken to prevent the spread of Zika virus in the U.S. The presentations and the discussions will focus on these, and you have seen these already. The first is key factors to reduce the likelihood of local transmission of Zika virus in the United States. And within this, we will be focusing on 4 themes this morning. And those are epidemiological characteristics, virus vectors and reservoirs, disease pathogenesis and consequences of infection, and clinical management and public health interventions and strategies. We'll look at areas where there's insufficient knowledge related to the key factors and prevention strategies. We'll look at research questions of specific concern, and among these are, for example, what studies are needed to establish causality or the absence of causality between Zika virus and microcephaly. And finally, what are the critical communication needs of evidence-based information for public health officials, providers, and the general public regarding the level of risk and associated risk factors, transmissibility of the virus, associated health consequences, and measures and strategies that should be taken to minimize the number of infections and prevent Zika spread in the United States. This is a standalone workshop. It is not part of an ongoing study by the National Research Council. I would also like to give you some sense of the format of today's meeting. We will have an open plenary this morning. We will have 10 speakers. Because of the weather, not all of them will be able to be with us in person, but they will provide focused content in areas of expertise to really look at some of the research and initiatives already established, but to understand better the potential gaps that need to be addressed. The afternoon will consist of a working lunch and 4 separate breakout sessions where discussions will explore in more depth these 4 thematic areas, the same 4 thematic areas that we look at this morning: the epidemiology, the virus vectors and reservoirs, disease pathogenesis and consequences of infection, and clinical management and public health interventions. After the breakout sessions, and during those, you will have a chance to really explore in depth some of these issues. The facilitators will prepare and then will bring back to the plenary when we reassemble in this room this afternoon the content of the individual sessions. During the final part of the afternoon, participants will have an opportunity to bring up other areas that have not been discussed and to bring up and mention other important Zika virus issues. There will be a publicly available summary of the presentations and discussions made during the workshop that will be prepared by a rapporteur and will reflect what has transpired during the workshop.
Muted.
It will be published by the National Academies Press. All of the views and ideas presented in the report will be those of workshop participants. There will be no formal consensus findings and recommendations coming from this activity, and it will not contain findings or recommendations by the Planning Committee.